That was another question I had, is how do people know, okay, I got this diagnosis, and one of the best and one of the worst things you can do is go online, I suppose, and find out other options out there. How should people know what might be best and not good for them?
That's so hard. You know, everything is a real personal choice. So I chose to save my breasts. You know, I could not imagine being a woman and trying to deal with cancer without what identified me as a woman. Is that the right choice for everybody? No. No, I believe, like I say, it's a very personal choice. How to choose the therapy, the right therapies, is really difficult because you're scared. You want it gone. You want it gone right now. And yesterday, you know, as soon as possible. You know, you see the Angelina Jolie effect. Oh, well, I'm going to get new breasts. You know, there's actual studies out there that show that prophylactic double mastectomies do not prevent cancer. I don't care what you are, if you're BRCA or whatever, they do not. In fact, cancer comes back. You can have a prophylactic double mastectomy and still get full-fledged breast cancer. So how do you choose is the big question. You know, that's one of the reasons I wrote the book I wrote, and one of the reasons I spent hours with cancer patients on the phone, is talking to them about how do you make these choices. You have to choose what works for you in your life, but not a knee-jerk, you know, not like, oh, I really want to keep eating chocolate and cake, so I want this gone as soon as possible so I can go back to that. You know, so I try and shift the cancer paradigm for them and say, well, you know, your immune system right now has presented you with cancer. Your life right now has presented you with cancer. So do you really want to boost that immune system? Do you really want to go back to that life? You know, you have to think about things. You want to think more about balancing your immune system. And because you could have an overactive, dysfunctional immune system. You want to think about what you put in your mouth, because remember, you are what you eat. So how to choose? There's so many out there. People are making the mistake, I think, in my opinion, they're jumping at the 3-week cures, 6-week cures, 1 month, 6 months. You know, cancer comes on in years. It doesn't come on in weeks or months or even a year. It's been growing for a long time. You can't imagine you're going to get rid of it like that. And so, you know, I tell people, just be very careful. And look, you know, if it's new, then chances are you're somewhat in the area of a guinea pig or a lab rat. And have you looked at those animals? Do you want to be a guinea pig or a lab rat? I mean, I don't. I don't want to do that. So, you know, be careful, the choices. Look for science behind it. Look for history behind it. Talk to survivors that have done the therapies. You know, step carefully. You can't undo some of this stuff, most of it. You can't undo a mastectomy. You know, it's impossible. So you can get new boobs, but what have you done now? You put a foreign substance in your body, and one that's been known to cause cancer, silicone. I don't know, it's just, where's the thought process? But it's not really a thought process, you know, it's that knee-jerk. So I always tell cancer patients, breathe. Remember to breathe. And then just think. Take some time. You got time.